I'm sure we're live now.
We might well be. Welcome, everyone, to another Holistic Vet Sisters. So, we're here again on Thursday at 6 o'clock to answer your questions from a holistic point of view and to support you. So, do feel that you can write comments and you can put questions in the comments and ask us. Tina keeps an eye on those comments as best she can. So, we'll try to answer as many of your questions as possible. So there's today myself, Caroline from the UK, Dr. Lise, who is in Denmark. I think I said she was in Norway last week, got that very wrong, but I don't know how, but there we are. It's the same every week, but I'm gonna mess up one week, I'm sure. And Tina, who is actually heading over to Australia. So she's going to go over and work in Australia in a practice over there, which I'm sure she'll tell us a little bit about soon. And also, we are really keen to hear the journey of Magda, who is our guest today. So Magda is Polish, but she is practicing in Los Angeles. So we're gonna hopefully hear from you, Magda, and hear your journey. And just before we went on, you were also explaining a new fascination with the use of leeches in holistic veterinary care. So we really want to hear about this. So Dzień dobry, Magda.
Hello. Yeah, so thank you so much for having me on the podcast. So as you were saying, so I was born in Poland, but I grew up in the US. Actually did 1 year of veterinary school in Poland, but then I went back to the US and I went to University of Pennsylvania. And I had some health issues during vet school. Now looking back, I think a lot of it was stress related, but it just kind of really quickly, I saw the limitations of conventional medicine. And it just kind of took me down so many rabbit holes with holistic medicine and biofeedback. And I tried acupuncture and diet and all these things on myself. And I pretty quickly realized that, yeah, this is what I want to do for animals too. So the year after I graduated, I took the acupuncture training in IVIS. And then, yeah, I pretty much never looked back. So ever since then, I've lived in a few places. I've actually worked in San Francisco and Colorado, and now I've been in LA for 9 years. And the whole time I've been a vet, I've always done integrative medicine, but really, I've always just loved the holistic side of things. So I definitely use Western medicine, but for me, it's always this challenge of like, where can I use it less and less and less, which has kind of been because for now it's like, for example, UTIs, you still give antibiotics. But recently I've had a lot of clients that are like, I don't want to do antibiotics. So you're like, okay, let's try this, and let's reculture. And so I don't know, it's always fascinating what owners kind of push you to do. And then that's how you just keep learning and learning ways to substitute the holistic treatments for the Western treatments. So 5 years ago, when the pandemic started, I knew I wanted to have my own practice, but it was just a tricky time to open anything. So I actually bought a camper van and I turned it into a house call practice, and we created you can sleep in and everything, but we used it for acupuncture. So the owners would like hand us their animal. We'd close the camper van door. We had like a cell phone, so there was like remote viewing, and we would like do the whole consultation in the van. So we did that for a year, and then once traffic came back to LA, I was like, yeah, I'm not doing this anymore, because you were like in the car for 2 hours to get in between appointments. So that's when I said that I really want my own clinic, but I want it to feel like a house, and I want it to have good parking, because that's something you never have in LA. And it took me like months to find this place, just because everything was like either in a strip mall or just something. And then finally I found this like adorable little house with all this parking. So I was like, oh yeah, this is it. So I opened my little practice, and we're pretty much only holistic on purpose. I didn't want x-rays. We don't do any surgery. So we pretty much only do acupuncture. We do ozone. I love Chinese herbs. So we do a lot of Chinese herbs, nutritional therapy. And yeah, so I really love it. I've had it now for about 4 to 5 years that we've had this clinic open. It's in like the north part of Los Angeles, La Crescenta, which is like sort of by the foothills. So we have these pretty mountains outside the window. And I've had a couple different vets that have worked at the clinic that either have known some holistic or that I've helped train. So we have a couple different vets working there now. So
That sounds amazing. I think we need to introduce a concept where we have to travel around and visit everybody who's been guests on this because
yeah,
I want to go and
I'd love
visit
to
your
have
clinic
you.
now.
You should, yeah. It's funny because everyone thinks LA is like the beach, but we are like, yeah, there's no beach anywhere near us. So,
But
but
is holistic medicine quite well received in LA?
you know, everybody that I tell that I'm a holistic vet in LA says, oh, that's the perfect place to do it because people love the holistic medicine. And I've sort of found that that's not entirely true. I feel, because now I've worked in a few different cities doing holistic, so San Francisco and Colorado. I want to be careful not to make too many generalizations, but I find that our clients, everybody's looking for holistic, but they very quickly want quick, they want fast results. And they don't always understand that holistic isn't fast results. So they're like, we tried this one therapy and it didn't work. And they're very surprised by that. So it's always this like re-education of like, if you want fast results, you do the conventional treatment. That'll get you fast results, but it is just a band-aid and it is really just there. Like it serves a purpose. If somebody's going through a really stressful time in their life, if they have like kids and this and that, like you just can't be going on this journey with your animal. Great, use conventional medicine. Everybody feels better. The animal's not suffering. But I feel like holistic is really for when you're ready. And I tell people this, I'm like, wait for there to be a calm time in your life when you can focus on the animal. And then it's really like, I consider holistic more of like a dance, right? Where you're like, we tried this thing and this, and we see how they respond. And, I always feel like there's many different ways to treat the same illness. And some of them, and sometimes you don't know what's going to be the magic bullet, but I'm always surprised by the thing that like you try and that like it is totally the thing that fixes that situation. Um, I've been staying with my parents in Poland, and my mom's dog, who's 14, I realized had sundowners. So like every time when the sun came down, she would start like walking and whining. And I was already thinking about like Chinese herbal formulas and things like that. But we were out of town. I didn't have any Chinese herbal formulas, and my parents had some rescue remedy. And I always find that flower essences, for whatever reason, work really well. So I was like, let's just give her a tiny bit of rescue remedy. And my mom said this had been going on for weeks at this point. I gave her one dose of rescue remedy, and it's been a week now, and she hasn't had any more. Like that's all it took. So it's always fascinating to me when you just like happen to find that one thing that animal needed that just kind of unwound the whole thing. So, but yeah, that's kind of why I love holistic medicine, because it's much more creative rather than just treating
Yeah.
the symptom. So
Yes, absolutely. Yeah. So where do leeches fit in then?
You really want to talk about leeches, don't you?
I don't
Only
want to
because
talk.
it's so fascinating what you were saying.
So I don't know a lot about leeches, but I'm always like, the thing I love about this medicine too is like there's always more to learn, right? I'm sure you guys know that it's like that slippery slope. Once you learn one thing, you learn the other thing. So my father's dealing with some autoimmune disease, and we've been trying all these different therapies in Poland, and all the conventional therapies and also the alternative. And we were talking to this practitioner yesterday. It was in a clinic that does a bunch of different things, and we happened to talk to the woman who does the leeches. And she connected me with this vet who also uses them in Poland. But she was saying she uses them for autoimmune disease in people. So Crohn's disease, IBS, and all these inflammatory things. And she attaches them to people's belly button. And you attach it for the therapy, and then she takes it off. So it's not like you go home with a leech, because that's what I was imagining, which is horrifying. Um, but she also said what was fascinating, and I didn't tell you guys this before, is that I guess the material shows up, and I could be wrong about this. The material like shows up either in the leech or either when the leech is removed, and based on the color, that also tells you something about what that person's dealing with. So like if it's brown, it's like a toxin. If it's yellow, it's something else. So the leeches like make the body secrete something too. So so one of the issues with leeches that has come up is that they have a type of bacteria, and I think it's like 20 to 30% of them. And when people use leeches, they can get really sick with this bacteria. So sometimes they'll just prophylactically have you take an antibiotic just in case. But what this practitioner was saying, who's been doing it for 7 years, is that there's a special lab that she uses that makes the leeches vomit. And as long as they're vomiting like every day or consistently, they don't get that bacteria. So she's like, I've been doing it for 7 years or whatever, and I've never, and on people, and she, you know, all the time, and I've never seen anybody get sick with the bacteria. So that was interesting. But yeah, so she connected me with this vet who's using it too, and he's using it for autoimmune diseases and intervertebral disc disease and all these things that, you know, we were saying, I've only heard about it used for like wounds, like the pododermatitis or ear issues. But apparently, you know, you can use them for a lot of other things, that they release some kind of like a beneficial enzyme that is like healing for inflammation and autoimmune disease in the body. So yeah, I don't know if I'll be brave enough to do it, but it exists. So.
But it makes me wonder, because with the silkworm enzyme, serrapeptase, that's been harvested. I wonder why nobody's harvesting this amazing leech enzyme and just maybe
Yeah.
of it yet.
Yeah, they use it. It is used in people now. So in conventional medicine, apparently surgeons use it when, especially like around the fingers, if you don't have enough tissue to graft, they will use the leeches, and it's not like on the fingers, and it somehow helps things heal better. So I've actually, because when I was looking into this, there are studies into that, but that's pretty much where it stops. So
I don't know. Is it removing something from the blood then by going to the belly button? It's kind of cleansing the blood.
I assumed it was like pulling something out.
Yeah.
But she was saying it's more than
yeah.
secreting something in. But I don't know how then that would create that weird color that tells you something. So probably maybe a little bit of both, but I am not a leech expert. I'll put it out there. I'm just learning this new treatment. But
I don't think learning that they, as long as they vomit, they're okay, makes them any less gross at all.
I don't think that helps their reputation.
No, it doesn't do it for me. Oh. So your practice is small animals, mainly dogs, or lots of cats, or exotics, or what do you see?
Yeah, I would probably say 70% dogs and 30% cats. Maybe that's wrong. Maybe 60-40. But yeah, so it's mostly dogs and cats. I love the exotic animals, but it's hard because like there's already so much to learn just in holistic medicine that to add other species into it at this point, I'm not ready for it, but someday I would love to.
So any famous people's pets?
Well, I have had some famous people. I don't know if I can share it on a podcast.
No.
Life in LA.
Names will be changed, but then it would be
that sort of ruins the story.
Yeah, we've had, you know, honestly, less at this clinic, more at the previous clinic I used to work at. We had some A-listers, so some interesting stories. Maybe I'll tell you guys when we sign off. But, yeah, we've had some. I've had someone else has had, a lot of, what are they called, B and C level celebrities too. But yeah, they can be fun.
So what about fresh food feeding out there? With it being so warm and what have you, I mean, is it something people are still doing?
Yeah, we have a lot of fresh food feeding. So because I don't know, think so much and learn so much about Chinese medicine, it's been interesting to live in different climates, and even how and so in my Chinese herbal courses, I often talk about this with my vet friends that live on the East Coast. There's herbs that they use that I can't use in LA, because it is such a desert climate. So it's very dry heat. So I often find that raw feeding, even though a good amount of our clients still raw feed, but one of the things we run into with raw feeding is that because raw food is so dry, and I think it's because it's frozen and we don't often have like blood in it, which is, you know, probably better for the owners. But you give them this like dry piece of raw food and it's cooling and drying, and eventually it dries out their stomach. So I have a lot of dry issues with animals where like acid indigestion, heat in the stomach, dry coats, things like that. So I often find that I end up doing a lot more cooked food just because it's more moisturizing. So it kind of combats some of that like LA dryness that we have out there. So, but yeah, it is so interesting working in different climates, and also just what are the different diseases that I see there versus that I saw in San Francisco or even in Colorado. Like it is completely different. Like we see, like one of the first things I noticed was kidney 3-point. I used to use that point all the time in San Francisco and Colorado, and I can't use it in LA. The dogs are all sensitive on it, and I don't know why. And yet all the dogs in LA have really good teeth. Like it's something with the kidneys and the teeth. Like we see bad dental disease, but nothing like I saw when I worked in New Jersey or San Francisco. Like you just don't see that degree of rotting in LA, which I don't know what that means. And people are like, oh, well, maybe they just take better care of them, but it's not true. My clients in San Francisco were so meticulous and were doing everything, and those dogs still had really bad teeth. So there's something interesting there. And we see a lot of protein losing nephropathy in Los Angeles. Like I probably diagnose it like twice a month in our patients. I see so much of it, but because of that, I've been able to, I use Steve Marsden's formulations for that, and it works really well. So sometimes it takes me a while to figure out which of like the 4 formulas is going to work. But I've had these these PLN dogs live for years. I don't want to say I haven't lost one. I had one, but that one came to me really, really late in the disease, and we still kept her alive for about 2 years. And I never use blood pressure medicine on those dogs because they just do so well on the herbs. But that's like a really common thing we see in Los Angeles. And we see the skin disease is a little bit different in LA too than it was in San Francisco. And certain formulas that I could use in San Francisco, like all the damp heat draining herbs, I can't use them in LA because immediately those dogs get worse because there's just not enough dampness. So now we're draining that, and now they're even more dry. And so they actually get worse. So I very rarely reach for like the damp heat formulas in LA. So it is really interesting.
That is such an interesting point that I have never thought about. The influence of the climate, the place that you live.
Yeah.
We're constantly saying, you need to look at each individual animal, and every answer that I give to any question almost starts by sort of with it depends. We need more information. There's lots of details, but that's an interesting aspect. Of course, the where you live and something as basic as the climate where you are. It's going to influence your health.
That's
Well, I
also
guess.
what I love
No, go on, Tina. Go
That's
on.
also what I love about Chinese medicine sometimes, is that it really has the answer to all the things that is not explained well in other branches of medicine. So it's like in acupuncture, for example, you have a point here on your neck called like GV14, and it's like the main point for like immunity. And that's how, if you're out without what's called scarf, if it's windy, that's why you're more prone to getting sick, because that acupoint is being cooled off. So I think, yeah, Chinese medicine, I absolutely love it. And I do want to address one question in the comments here as well from Amana, because she said, I thought raw food had very high proportion of water. Oily fish also helps with the coat. Omega-3s are really important for anti-inflammatory effects. But now Magda is talking about Chinese medicine, and in Chinese medicine, raw food is very cold and can be a bit more drying. So that's what she's talking about when she's saying the skin and coat gets a bit drier. And
yeah. And it's honestly something, so because, when raw food, especially when I graduated, was just kind of starting to come out into something that more vets were talking about and learning about. And one of the things I heard all the time was like, oh, raw food's so amazing. It makes their coat great, their teeth great, they're this. And one thing that I saw, and in sometimes it does, but I was surprised at how dry these coats were of the dogs eating raw food. And I don't have an answer for it. So I have a couple theories. I mean, sometimes the raw foods just have too much bone, and bone is very drying. So if the stool becomes that like chalky bone dry, then I'm like, there's too much bone content, and that can make them dry. But I do find that raw food in general is a little more drying. And I think it's just because we keep it in the freezer, right? And the freezer is just drying. So it's like, yes, if an animal ate an antelope in the field, it would have a ton of moisture in it. but it's just kind of a necessary evil of the way that we're processing it and bringing it, that by the time the animal eats it, it's sat in that freezer for a while, and now it's just like a dry piece of cold meat. So it's like I had this like revelation one day, because before I got into a lot of the holistic things, I had a dog, and I would give her different types of kibble back in the day, and one of the kibbles was really oily, and it's like I noticed that when I gave her that food, her coat got really nice. Whereas if I gave her one that looked really dry, she got really dry. So it's interesting how, like, if you consistently feed them that same food, it's almost like the animal, I mean, obviously it makes sense, but like, look at what you're feeding and think about how that is going to impact the coat. Like dryness can impact them internally too, like dry stools, constipation. I see a lot of that dry heat in the stomach. So once they start eating grass, things like that's really that like dry heat in the stomach that I treat all the time in LA. And it responds really well to that formula Yiguanjian, which is like that like cooling, moisturizing stomach formula. So I feel like I'm giving that out like candy in LA. So we use that herb all the time. So, but it's a formula that my friends in like in Massachusetts, they're like, oh, I can't use it that much because it's too moisturizing, and we already have so much dampness in our climate that like I don't reach for that formula as much. So
Yeah, I generally found kibble very drying, but now that you mention it, I think also because you live in a dry climate, that probably contributes to it. So that is worse for these animals living in that area, maybe compared to someone living in a more humid area, for example.
Exactly.
And a lot about how it is stored and processed as well. If it's, homemade versus commercial raw, how it is stored and what the ingredients are, and so on and so on. So yeah.
Also, what you were saying about blood being in raw food is so key. It really is. And a lot of them are quite dry. That we don't tend to see that so much over here. I mean, thinking of the brands that I use, I like to see the blood in the food, I mean, we know it's better for the biome. The mucin in the blood is better for the microbiome. So yeah, maybe it's partly the way they're created there as well.
Yeah. And maybe not all of them too. Like I haven't done an experiment. I just notice, like even like the raw patties, they are just pretty dry. Like I think of like Primal or one of those like foods, like you don't see a lot of blood, but
It's
which makes sense.
fascinating because we don't tend to think of the environment, as Lise was saying, do we, so much always? And also it could be that if you've rehomed an animal from a different country, perhaps things were different in that country or that county or that state to where the animal is now. So you're sort of trying to, you're thinking of it from both points of view as well, aren't you, I suppose, for the environment. But back in the day, we wouldn't necessarily, humans wouldn't necessarily travel that far from home. So the biome in that area was sort of quite contained, whereas now things are shifting and changing. I'm wondering whether in LA, with all the busyness and the rushing and the high vibe and all that, maybe that's part of it as well. The whole energetics of LA itself is drying,
Yeah. I feel like most of what I deal with is stress. Like, so it's just a sort of necessary evil of living in a place like that the animals are just going to be more stressed. So a lot of the diseases kind of stem from that.
Bless them.
So, yeah.
Oh.
Which is harder, but yeah, there's, they get beaches and other things. So I guess there's benefits too. So.
Should I start it on the questions?
Let's hear a question.
So I had one more particular on homeopathy as a quick one for Lisa. So in your opinions, what are the things that people, like every clinic should have of homeopathic remedies, and how to use them? So for example, arnica and tuya, do you give the tuya before, after, the same time? The arnica, do you give them before surgery, after surgery? If you have some.
So for veterinary clinics, not it's not necessarily different, but that's a brilliant question. And I'm really impressed that we've been doing this for that long that you're answering it now, because they would definitely be my main ones. I mean, I think I know lots of clinics where everyone who comes in for surgery, even if it's just, dental or whatever they need doing, they'll just be given arnica. And arnica is amazing to support an animal through any kind of physical trauma, you know, tissue that gets hurt. Doesn't matter whether it's a tooth being extracted or you know, it's a knife involved, but surgery is just a situation where you know that, you know, I'm going to suffer an injury tomorrow at 8 o'clock because, you know, someone's taking a scalpel to me. So you can give arnica before you even have the injury. But any sort of trauma, arnica really makes a difference. It promotes healing. It helps with pain, swelling, bleeding. I think it's almost irresponsible to have any kind of procedure done without taking arnica. And it's the most amazing remedy for that. Physical trauma. Sometimes the word trauma is thrown about so lightly that I quite often hear people talk about, you know, oh, I was so stressed, or I was shocked, or I was, you know, I took some arnica, and that's a misunderstanding. Arnica is for the tissue level of trauma. It's not for feeling stressed out. It's for getting physically hurt. But it doesn't matter whether it's a fracture or a bruise or a major surgical procedure. Arnica, 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 arnica. And you can't overdo it. In that acute situation, a dose before and just lots of doses as they recover. I wouldn't normally keep giving someone arnica until stitches are removed if it's for a surgical procedure. And the other one, like Tina said, the other obvious one is Thuya, that I give to everybody and would recommend for everybody who's having a vaccine. Doesn't matter what the vaccine is, and it doesn't matter whether it's a human or a cat or a dog or a horse or whoever it is. I like to just, I mean, I know vets who will just give sometimes not even discuss it with the owner necessarily, just give them a pill or a drop of Thuya in the mouth and then inject the vaccine. And that's probably enough, but I tend to recommend that carers give sort of wrap the procedure in Thuya. You know, I normally give a couple of doses before and a couple of doses after. And if there are any signs that any side effects, you know, if there's a sore lump or if the animal is under the weather, then I would keep giving them Thuya once or twice a day until that's all gone. But those would be my absolute main ones. There's other ones like calendula is amazing for wound healing, any sort of wounds that don't heal, you know, sore skin. If it's an allergy or something like that, it needs a deeper acting treatment. But if it's an abrasion or after incisions or anything like that, then calendula can really promote wound healing. So that's a good one to know as well.
I didn't know calendula was a homeopathic remedy too.
It's funny sometimes that overlap between herbal and homeopathy. You know, sometimes it's the same plants that we use, and sometimes we use them from the same things, and sometimes we use them for completely different things. And of course, sometimes in homeopathy we can use really toxic stuff as well that you couldn't use in any other form. But yeah, calendula is a big homeopathic remedy for wound healing. Sometimes you can just, I mean, it's a good one to have at home. If you any cuts, sometimes it's almost like you can sit there and watch it heal. You know, just doesn't matter if it's yourself or your kids or your animals, but anyone who cuts themselves or if the skin is broken, calendula is amazing.
And can I ask you a couple questions then about arnica? So if they remove a tooth, are you concerned about, like, if it's a pill, putting sugar in the mouth after surgery?
I'm not really. I mean, sorry if there's barking in the background. Homeopathic medicine can be given in any form. So it can be pills or tablets or powders or granules. And if there is someone who doesn't like taking sugar or doesn't like having anything put in their mouth, you can even just dissolve it in water and let them drink the water or give them a little bit of the water. You can take it in so many different forms. The main thing is it shouldn't be the process of giving it shouldn't be stressful in itself. You know, that's you need to find a way to do it that the animal will accept it. But it's generally much more. I have so many, I mean, every day someone will say, well, we can't give them pills. You know, absolutely cannot give pills. And then it's once it's a homeopathic pill, it's just a different thing. They don't have to swallow it. It doesn't have a bad flavor. As long as it goes in the mouth, you know, just put it down, put it in the their cheek or down by their gums, or there's none of that, you know, open and force it in and make them swallow, and that whole intervention almost is, it doesn't have to be like that. You can
you
just
try telling Fusa.
No,
I
it's
put
fine.
hers in her water bowl.
Yeah, I mean, that's plan B, and that works fine as well. What you shouldn't do with homeopathic medicines is put it in food. You know, it shouldn't go with food. It shouldn't go on a treat. The flower essences are fine to go on food or on treats, but homeopathic remedies shouldn't. So straight into the mouth is the ideal way. And giving it in water is second best, and very often works as well.
So
And
what
what
about that other saying, if in doubt, give Nux Vom? Would you then have that in the clinic as a if in doubt?
Nux Vom is I mean, it can be used in lots of different levels, but it's on this sort of first aid, you know, easy approach. Nux Vom is for toxicity or overindulgence. It's also a remedy for hangovers, you know. It's for animals that have got access to, you know, eaten the contents of the bin, or got into food storages somewhere, or it's for those sorts of situations. And it can, you know, can also be, you know, dogs that eat appalling things outside and get sick from it. Nux Vom is one of the remedies, not the only one by far, but one remedy, possible remedy for that.
What about after surgery? Because all the drugs.
After surgery, the main one is arnica, because arnica is just that whole process of the trauma of the surgery. It can be other ones if you have, like if you have if you're sore after having been intubated, for example, calendula is a good one. If you've had a catheter on a cat, maybe calendula can be good. Staphylococcus aureus can be good for that as well. So it depends a little bit what's been happening, but arnica is the big one around surgery, definitely.
And what do you think about cream? Some people put arnica cream. Does that work, or how?
Homeopathic remedies are always best given internally. There are products, and I think they're mostly for humans, and sometimes it's just the process. It's nice to use a cream. They work best if you take them internally. They're supposed to be absorbed from mucous membranes. And for animals, I think creams on the whole are not that useful. They've got, you know, they get stuck in fur, and they can very often make animals, I mean, I would say all cats and most dogs will think there's something sticky on me, so I've got to lick that area, and that's just very rarely helpful. So giving them into the mouth is the best way. But I mean, it's about mucous membranes. So if we treat cows, it's often the vaginal mucosal membrane. You know, farmer treating cows will often just go and spray them all, because, you know, they're presenting rear ends often when they're in a farming situation, and rather than give it in their mouths, they will just spray remedies on their vaginas. That's a nice available mucous membrane in that situation. But generally speaking, we put them in the mouth. You can also often just smell them. That's also a way to do it.
Oh, interesting.
Sometimes for cats, with a liquid remedy, if you can just sort of put a drop on their nose or a drop on their lip, they'll either lick it or they'll just get the smell of it and get the remedy that way.
Some people asked that, or they said that they were told that yogurt is okay. You mix homeopathy with yogurt.
It's further down the alphabet. I mean, it's not ideal. Plan A is definitely into the mouth, or another mucous membrane. Plan B is water. Yogurt may work, but if it doesn't work, that could be the reason. I've also treated feral cats where you just couldn't get to them, and sometimes what we've done is put a pill on a bit of butter and then put it on the cat's leg or something, because then it'll lick it off and it'll hopefully get the pill, and the butter won't have too much of a flavor. And sometimes it works, definitely. But I've also had situations where I've treated, it's generally cats if we can't get them to take the remedy. And I've certainly seen more than once that you treat a cat with a remedy and it's not responding. And then we just decide, okay, before we change the remedy and, you know, rethink the whole plan, let's just make sure he gets a dose or two properly. So you kind of get towels and gloves and helpers and just make sure that, you know, you're going to get this dose into your mouth, and suddenly it works fantastically. So sometimes putting it in the water, it doesn't get, it's not as effective. So it can work in food, but if it doesn't work, before I start thinking about changing the remedy, I would try to administer it differently. And it's almost always much easier than people think it's going to be. It's not like giving any other kind of pill. And a lot of it is about, you know, if you think, oh my God, I'm going to give this pill to this dog or cat and they definitely won't take it. And, you know, well, how are we going to do it? And I'm going to call in the neighbors. And the dog or the cat knows immediately, I don't know what you're planning, but I'm not having it. But if you can just know that this is beneficial, it's in a sugar form, it has no bad flavor, and just, you know, sort of be centered and calm, have it around. Think about your own breathing and your own feeling about it and your own vibes about it, and just be calm, have it around. And when the animal is relaxed, all you need to do is just, you know, stroke them a little bit, put it in the mouth. You don't need to hold them down. You don't need to force the mouth open. You don't need to see where it goes. A pill, and it is okay to touch them. You know, clean, dry hands. You can touch a pill. You can just put it in there, done. Doesn't matter. It doesn't have to be swallowed. It's fine if they spit it out again. It takes a split second. So it bears no resemblance to giving any other kind of pill. So often it's our experience of what we can and can't do that's the limiting factor. But actually, if we're just sort of just giving them a bit of sugar, you know, why would he mind that? And once it's in, they can do what they want with it. You don't even have to hold the animal at all.
Yeah, I think Liz is making a very important point here, is that they don't actually have to swallow it.
Mm.
It's just the contact with the mucous membrane is enough. So you can literally just, like, when they're chilling, you just put it in their lip, don't care what happens to it, and that's it.
Yeah. Yeah.
And there was another question here from Irma. She was asking if the dog is tired or low after sedation, any homeopathic remedy you can suggest?
I mean, the main one, the main general one, after any kind of whatever they were sedated for, I'm going to have to go back to arnica. And then there may be other remedies depending on the specific situation. You know, what was wrong with the animal and what specific procedure happened and who are they? You know, what something that supports them. But generally speaking, I just cannot sing the praises of arnica enough. It makes such a difference. Amazing difference.
Perfect. Let's go on to another question. So Leslie had a question here as well. She said, hi, my dog Flynn has had his anal glands done in April and is still licking the area. Is there anything I can do to help him? Leslie, do you want to start this one, Magda?
Sure. So what I tell people with that, I mean, first of all, they can fill up again. I have a lot of people that come 6 months later and are surprised that anal gland cleaning 6 months ago is no longer working. So I don't think that people realize that they can fill up again even within a few weeks. So there are some dogs that just need to have it done more regularly. I have also, there's a supplement we use in the US called Glandex. And it's kind of a fiber supplement, but it also has nettle and some anti-inflammatory things. And I have seen that work pretty well. It doesn't always get rid of the issue completely, but it at least allows the pet to go longer between the anal gland expression. And then for Chinese herbs, I usually use Langdan Shegantang. So that is one that I have seen because it ends up being kind of like a damp heat situation. That some pets have benefited from that Chinese herb. So those are usually the things that I try. There's always like the add fiber to the diet, just like pumpkin and psyllium. I don't know that I've seen those things work that well, but they do seem to work a little bit because they're just making that stool bigger, which allows the pet to express the anal glands naturally at every bowel movement. So
I wonder what, is it Leslie? I wonder what she's feeding. We don't know, do we? No, it would be better for the dog to be on a fresh food diet, whether that's cooked or raw, would definitely be better. If this is going to be something that continues to happen, that would definitely support the entire glandular system.
Yeah, what I would say primarily about anal glands is that it can be part of an allergic response. So if you have an atopic dog, anal glands are often inflamed as well and overproducing. So it may be part of treating a bigger pattern in that individual. It can also be just a mechanical issue if the stools are generally too soft, so the anal glands don't get expressed properly. And in that situation, it's about getting the stools right. And like Caroline said, putting them on a raw diet with lots of bone can very often do that. But I mean, my main thing about anal glands is that there is a tendency, it's interesting if it's the same in different places, but I certainly find a lot of vets, a lot of vet nurses, a lot of groomers even almost seeing it as a kind of service to just check the anal glands and just empty the anal glands and go, oh, there was something in there. Good that we got it out. And my main message is just stay away from them. You know, unless there's a problem, you're going to create a problem if you keep, every time you squeeze them, you're contributing to them being inflamed. It's a system that should regulate itself, and if it does that, we should absolutely stay away from them. Just like we shouldn't be cleaning ears if they haven't got a problem, and we shouldn't be squeezing anal glands if there isn't a big problem there. Because if you squeeze anal glands regularly, you're going to get an anal gland problem. And the last thing I would just say is if someone's got chronic anal gland problems, is an osteopath or a chiropractor or someone like that can often help. Maybe there's been, I mean, if there's been inflamed or infected anal glands, there may be a memory of pain in that area, or there may be, you know, something there that you can release and help the animal just function in a more balanced way. So
we had a holistic vet talking about that a few episodes ago, didn't we? A lady, it wasn't Ricky, it was a different one of her friends, I think, one of her vets.
Oh, but was it with the tuning forks?
Yeah,
maybe.
She was talking about a dog that she'd only recently worked with, I'm sure, that she had really supported with the anal glands with fascia changes.
Yeah.
So it's often the last thing we think about, but actually a lot of success.
Yeah, I think the thing with anal glands is usually it's a hint to a bigger problem. It just depends what that problem is. And like you mentioned, it can be a lot of different things. In some cases, it's really just the anatomical position of the anal gland doesn't empty very well. So some are predisposed to struggle with it. I find maybe most of the cases I see is usually they also have itchy ears, they have itchy skin, they have loose stools. So very often, in my opinion, this roots down to, you know, as she was talking about, food intolerances and that their stool is not hard enough. So that's the question. Why? Is there something wrong with the digestive enzyme? Something about the diet? Is there food intolerance? Is there a reason things are coming through faster than they should? So yeah, I think getting to the root of the problem is important. There are some things you can do that can be helpful, like adding something that makes the stool a bit bulkier, like a fiber supplement, something like that. Bones are very great for bulking up stools. Obviously depends how their digestion works as well. And then yeah, something sometimes it can be even an AGA deficiency, so it can be connected to a lot of different things, but I think it's good that you've noticed and then try to get to the root of it. Sometimes in holistic medicine, you really need to try something, maybe fail and try something else. It's not always straightforward, and the answer is not always very obvious because there's a lot of testing lacking for a lot of things.
But it is easy to do too much when it comes to anal glands, and expressing them manually is definitely my main point. You know, don't do it just to be, don't get them emptied every whatever. I mean, I have seen lots of dogs who get their anal glands emptied every 3 weeks or whatever, just to stay on top of it. And I think that's a really poor practice. You know, it's really better not to. If they possibly can manage it themselves, then that's going to be better.
Yeah, and also just to mention it, sometimes I have seen dogs that lick their bum that have other issues. They actually have skin issues around the anus. So it's obviously important to have it checked out by a vet and see that there's nothing else important going on. Do you guys want to talk about the microchip situation? And maybe as a final question. So there's actually, I just found this going through some Facebook groups that people post a lot about microchips being a route of inflammation and can trigger autoimmune disease. So some owners are advocating to not microchip their pets. And then they associate it with breast implant illness that happens in people. It's becoming more and more of a thing. Do you guys want to start this one, Lise?
Well, you know what I'm going to say, I think I don't know, I'm sure there's various rules in different places, but anywhere I've practiced, it's the law. You have to have your pets microchipped. So it's not optional. But this also means that all the dogs I've seen for more than a decade have been microchipped. I have not once seen it be a problem. So I think it's one where social media maybe just is running amok a little bit. I just like to kind of bring things back to what do I actually see in the clinic, what is a problem, and I've never seen this be a problem. So I can't say that it's something that concerns me at all. I think microchips are, benefit far more than they harm anyone. I've never seen them harm anyone, but I'm sure it's theoretically possible. What would you say, Magda? What do you feel about?
Agree with you. Yeah, I mean, it's so hard in this world to know what's affecting what, but you're right. Most of the dogs I've treated are microchipped, and I mean, could it be adding to their illness? Maybe, but I don't know. We're able to fix most of their illnesses with herbs and diet and things like that. Yeah, I did have a client recently. So they are not required legally in the United States. So not every dog is microchipped. I guess you could test and see a larger study to look at any changes, but it is required if they want to travel to Europe. So a client was trying to ask us to write a letter so that the pet could travel to Europe and not be microchipped. And I said no, because I didn't really know what to say. I don't know, like there's no studies. It's just a theoretical fear. And I didn't even know what to write in that kind of an exemption letter. So, but yeah, but maybe 5 to 10 years from now, we might find out that it did create something, but I don't know. I wouldn't go trying to cut it out of your pet, I guess is what I would say.
I think
Until
years ago they used to migrate, and it's probably a historic misunderstanding or a historic myth that's hanging around now. Well, it wasn't myth at the time, but perhaps is now. They used to migrate and move about the body quite a bit, but not anymore.
They can do that depending on how they're injected,
and
but it doesn't seem to.
Yeah.
I mean, sometimes it's just a bit hard to find them, but I've not seen that cause any problems. The sort of fear mongering that I came across when it was years ago was that there was going to be tumors. They were all going to get cancers around their microchips, and I've not seen that at all. And anyone. Go on,
Wi-Fi,
sorry.
EMFE stuff. It won't be Wi-Fi, but do they have any EMFE stuff going on with these microchips or something?
That's what they're claiming. They're so tiny. I mean, I guess we could measure it. They have those little EMF machines. So it'd be interesting if people could measure their pets and see if there's a part of their body that they're reading higher EMFs than another one. So, although those can be fickle too, because like you just stand in a different part of your house and like where you test completely changes. So, but yeah, I guess that's something you could test.
Yeah, that would be interesting to see. Didn't even think about that. I just know if you compare it to humans with breast implant illness, obviously it's not the same material. I think some of the reasons they say this can cause chronic inflammation is because this creates this fibrous tissue around, like a capsule around it from inflammation. And they're discussing the production of biofilm when the body is trying to reject something or isolate something in the body that it's not supposed to be there. They're also talking about the potential toxic chemicals in what you put in. Now, I know that at least all the ones I've checked, the microchips we use are usually made of glass, which shouldn't be very reactive. Some suggest that it can cause autoimmunity, but again, breast implant illness is still very controversial in people, and there's not really much backing up this in animals. So I guess we don't really have any data saying that it is an issue. But I think also, especially in like cats, if you lose your cat, it's really the only way you can, identify it and find it if someone else finds it. So I think it's a pros versus cons, is the benefit might outweigh the cons, at least for now.
There is a lady, I don't know if you've seen the same messages as me, Tina, but Kim, and she's asking about collapsed trachea. and what there might be possible to help. I mean, she's mentioned a homeopathic remedy, but I mean, there might be other things. Magda might know of some other options as well.
Yeah, so in Chinese medicine, there's a couple ways to look at it, but there's a couple patterns that can create it. One of the most common I see is one called Xiaoyang disharmony. And there is a Chinese herb called benefits hips and knees. And it's always interesting how the cartilage, right? Because it's in the trachea, but it's also in the joints. So a lot of times you can use joint formulas for the collapsing trachea, but I'll usually use that Chinese herb, and I've gotten pretty good results with it. Sometimes if I don't get good results, it's actually not the collapsing trachea that's creating it, but more blood deficiency. And then I'll use a different formula called Shui Fu Zuyu Tong. So those are kind of the two that I alternate between when it comes to those cases. But it's, yeah, anti-inflammatory diet, all the usual things. And that pattern, that Xiaoyang disharmony, it seems to be related a bit to gut too. So making sure the pet's on probiotics and all those things that seem not related, but can actually really help to bring down the inflammation. I had a dog, now that I'm thinking about it, who had collapsing trachea, and all we did was took him off kibble and started cooking, and he completely stopped coughing. So it can be just like an inflammatory, mucus production type of thing too.
That's why the remedy in the comment is Drosera. That ring, yeah, it would, because
I wouldn't, I mean, I would argue with that. I don't think Drosera would be a remedy. I mean, Drosera is sometimes used as an acute remedy for coughs, which is probably why it comes up here. But it would be more of if it was a kennel cough, or, in humans, it's used for whooping cough, or, those sort of infectious acute situations where you cough. You might think of Drosera. I've never used it in a collapsing trachea, but that is more of a chronic, ongoing issue that needs a more individual approach. So I would sort of say that there isn't a homeopathic remedy for collapsing trachea. If you had, it's normally elderly dogs, very often elderly dogs of small breeds, and they need a remedy that suits them. They need their remedy. And there may be a dozen remedies or so that one would think of first in that situation, but Drosera is more of a acute, infectious, violent cough, and a collapsing trachea is generally speaking not that. It's more of a lack of what's the word, stability, or the tissue isn't rigid enough, or there's a lack of tension, or it's in the word collapsing, isn't it? It's more of a chronic old age degenerative problem that needs that type of remedy, but one that's selected for the individual patient.
I think the only thing I would add here is electroacupuncture. Quality diet, anti-inflammatory diet with good quality, maybe supplements. You can consider some herbs, but it depends a lot on what the animal is showing. Otherwise, their age, their signalement, their other issues, then I would try to support that, because sometimes they have more issues, and then actually by focusing by the other issues, then the other issues goes away, which is quite interesting when you start looking at the body on like a whole perspective. So yeah, individual case as well. Would always recommend to see a holistic vet.
Yeah, absolutely. It is the exception would be very acute diseases or first aid, but when we're talking about chronic processes like this, it's about finding the remedy for the individual, whether that is acupuncture or herbs or homeopathy or whatever it is. But it's sort of the whole holistic concept is you need to find something that suits that individual on a deeper level.
Yeah, and I think I just want to highlight as well, there was a lady that wrote a lovely long comment for a Sarah about her dog's mass. I think it had, don't know if it was a cancerous mass, but she has booked an appointment with our Tina, which is a really lovely thing to do. So I think that's really important. Tina is helping you with your dogs online as well with online consults. So she'll be able to do that from Australia, we hope, although the time scale might be a little limiting.
Yeah, I need to find a new. I don't have any appointments open at the moment because I need to figure out my schedule and the time zones and all that. So I'll put up more consults next week. But yeah, I think some of the questions we'll get are very long and very extensive, and it's basically a consult. So I feel like, yeah, it's better to ask very specific questions and we can talk around that. If you have, a full case, maybe you will get more out of booking a consult because then we can look at your individual pet, their whole history, and actually attack it from all angles, and you get private support the whole way. So,
But it gives us a chance to make that general point, which is such an important point, I feel, that if it's a chronic situation, it's not a remedy for the condition or a treatment for the condition, it's a treatment for the individual, which sounds simple, but it's such an important distinction to make.
yes. And I think Magda will be open to consults now too, won't you?
Say again, sorry?
I guess Magda will be open for online consults now too, won't you?
Yeah, I'm hoping. So in the next few months, I'll set something up. So not just yet, but yeah.
And where can people find you if they would get in touch with you?
So right now, that's a good question. So my clinic is called Holistica Veterinary Clinic with a K. And on that website, you can find my blog, which is drmagdavet.com, I want to say. And I think it's that .com, not .blog. So you can find my blog, and there's a contact through the blog too, or through the clinic website.
We should put the Magda's details or Magda's website in with this video, shouldn't we? That would be a good idea.
Absolutely. I know Magda has an appointment to run through, so I don't want to hold you too long.
Yeah, thank you.
But do you have a final saying to our listeners, or a final advice, or?
I don't think so. I mean, yeah, I agree with everything you're saying. Like it's a tricky thing because we want to just treat the disease, like you were saying, collapsing trachea. It often is the pattern, and sometimes people don't always understand that. So it is a bit of, I don't want to say trial and error, because it's a little bit deeper than that, because when you try something and you get a reaction, that tells you more about the underlying pattern. So really working with a holistic vet that kind of understands these patterns is going to get you a better result, but you have to be patient and understand that we may or may not get it on the first try, but sometimes that information can lead us more towards the correct formula. So
yeah.
So next week we won't have a show. Tina is traveling. I am also traveling because I'm going to the Dog Risk conference in Finland, and I think I won't be long off the plane. So yeah, probably. And Lise, I'm not sure where you are, but somewhere lovely, I hope.
I'm celebrating my son's wedding.
Oh, there you go. Oh, definitely.
Yeah.
So no show next week, but we will be back the week after, definitely. We don't know whether we're dragging Tina out of bed in the middle of the night yet. We've got to persuade her after this when we sign off. But yeah, well, it's dark where you are now, so it's not, but it is on your camera.
It is on my camera, yeah.
Okay, well, it's been lovely to have you with us, Magda.
Thank you.
And we hope you'll come back at some point.
Yeah,
I'd love to.
absolutely. Very nice to meet you. We'll have to make another appointment for you to come back.
Sounds good. I would love that.
Thank you very much.
Thank you.